question is management. How are mental health conditions managed? What are our expectations? What are the outcomes? How effective are our systems of treatment and management? I personally believe that we need to think of mental health and mental health conditions just like we do any chronic condition, diabetes, hypertension. We need to prevent it. We need to screen for it. We need to diagnose early, and we need to institute treatment and follow-up, and do that in a systematic, methodical way. So what treatments are available and how effective are they? I'll ask the panelists and open it up. We'll start with the Maui, Mid-Atlantic Wellness Institute first. In very broad terms, that's like asking what treatments are there available for medical conditions. And of course, diabetes is treated quite differently from hypertension. But we're really asking you to speak in very broad, general terms. What are the methods that are used?
Well, I think, looking at the big picture, and I appreciate the question is actually more about the small picture, but looking at the big picture, some of the treatment is about political decisions. Political decisions change people's mental health, about government, about agencies, about family life, about community values, about how we look after each other, about what we believe in, about taking notice of other people and noticing when they change or when they're struggling, coming through into institutions that children go to, for example, schools, where children are noticed to be different or struggling, bringing them to health professionals, and then going to the smaller picture. For example, at Maui we would see the more severe end of the spectrum, and that's correct because the buck stops with Maui. There's no other, or there are some patients that get sent overseas, but that's correct. So the point I'm making is that the treatment is actually very, very broad and affects all aspects of our lives. But talking more specifically about the diagnoses of mental illness, there are very effective treatments, and there are only a few. And I say this virtually every day to parents. So there's talking therapy on your own, in a group, in the family, and then there's medication, and then there's advocacy, there's liaison, and then there may be a few cases where there are medical conditions giving rise to psychiatric conditions, so the treatment will be the medical condition. And that's it. And I say we don't have some magic that we keep in the drawer down there for only certain patients or families. That's it. It's about talking, it's about being in a group, it's about medication, it's about getting back into the community. So that's the big picture. We could talk about specific syndromes and diagnoses and treatments, but I think the question is more about the bigger picture than actual diagnostic grouping.
Okay, as I said earlier, if 1 in 4 persons in Bermuda as worldwide suffers with mental illness, obviously there are more out than in. And a lot of people used to say that as a joke, but it is the truth. There are more people with mental illness outside of MWI than there are inside of MWI. A lot of people look at the size of the building and think that all those windows are bedrooms. That's not true. And those of you who've been up there know that there are only about 23 or 26 beds for persons with acute mental illness for the entire island of Bermuda. So persons with mental illness, for the most part, are treated within the community. And what treatments do we have to offer? We have to look at the individual and what are their needs. And those needs can range from anything from the need for housing, the need for socialization, the need for directing as to how to get what they need, talk therapy, family counseling, family therapies, art therapy, rehab therapy. Whatever it is that person presents with, that is what Mid-Atlantic Wellness tries to provide. Unfortunately, a lot of the things that we do possibly could have been done within the family structure, but it seems, at least for the clients that we see, those persons that we see, it's like the families or society says, okay, this person has mental illness, they belong to you. Whereas persons with mental illness belong to all of us, because we are, every one of us, are just a very thin line from going over the edge and becoming one of the mentally ill. Many people think of mental illness as those people, but it is all of us. So what are the treatments? We have to ask ourselves, what is it that we need? What do we need to make us feel fulfilled and a part of the community? Those are the treatments. And how do you get that? Sometimes you may not be able to establish a talk therapy until that person's mental state is stable enough. So you may have to start with medication in order to allow that type of communication to take place between you and the individual. And then you can start looking at other modalities of treatments.
Would it be helpful to think of mental illness as a chronic condition where you have episodes of real serious illness and episodes of wellness and health, and that not all treatment takes place in the hospital, but takes place in a variety of settings? And it is my perception that many in the community associate going into the psychiatric hospital as something that's terrible and to be avoided, and that's part of the stigma, not realizing that just as you go to King Edward to get well from an acute episode and to return to the community to lead a productive life, the same thing happens with mental health conditions. I'd just like your thoughts on that, and perhaps you could explain the evolution of treatment in Bermuda, where everyone thought you went to the hospital and you said goodbye. But really, the professionals at Mid-Atlantic Wellness have done a tremendous job of moving people from the hospital setting to the community setting and putting a number of supports and things in place. And I don't think most of the public actually appreciates the tremendous work that has taken place over the years in that regard. I'm hopefully someone will, Mid-Atlantic will.
I just want to chime in very quickly about what treatments are available. In addition to everything that these people have said, there is a tremendous stigma affiliated with being medicated. I have a lot of people come to me and say, oh, you know, I want to go to the doctor, but I don't want to go on any medicine. I don't want to take anything. I don't want any crutches. I don't want any this and any that. And we really need to get better at educating people on how these things can help them. I'm not pushing medicine, certainly, on anybody who doesn't require it. But when I hear people who I clearly think should be seeing a doctor and perhaps being prescribed something, say that, you know, they're just completely against the idea because they think of it as something only for people who have a severe, a very severe schizophrenic condition. That's troubling to me, that there is still this stigma attached to being medicated. I am medicated. I will probably always be medicated, and it has changed my life absolutely for the better. I don't know. I can't say that that's going to be the outcome for everybody. If you go to a physician or a psychiatrist or a talk therapist that you don't resonate with, go to another one. If you have a friend who's been to one and they had a bad experience, encourage them to go to see another one. There's a lot of them out there. They will find one that works for them. Same with medicine. If you try one, you have a bad side effect, or it just didn't work for you, don't give up. There are others. There are a lot of things that can be done for the conditions that are out there in the community.
Again, 1 in 4 persons with mental illness in Bermuda. So clearly, MWI only sees the tip of the iceberg of people in Bermuda who suffer with mental illness. And the ones that we may have that may pass through the system and may require housing or may require hospitalization. It's only a small number compared with the numbers of people in Bermuda who suffer with mental illness. And we have to clearly take the face off who is mentally ill. Because I'm looking in the audience right now, and I don't know who has a mental illness, just like you could be looking up here right now, and you may not know if I'm suffering with a physical illness. And that's how it is with mental illness. We have to do this sort of comparison. Persons who have physical illness, just like the moderator says, when they are really ill and cannot cope with their physical illness outside a hospital, they go in hospital, they get treated, and then they go home. The same with mental illness. You come into the hospital, if you need hospitalization, you will get treated, and then you should go home back with your family. But that doesn't always happen. Excuse me? I'm hearing voices, sorry.
I was just mentioning to Mr. Rogers about discharge planning, and I know MWI does a lot around that in regards to following up with case management in the community with persons in the community. So it's not so simple as coming into MWI and then being discharged and they cut you off, right?
Right.
But I also, and maybe the doctor can speak to this a little bit more as well, but there are lots of treatments out there that are currently incorporated in Bermuda as far as supportive employment, supportive housing, mobile, do we do a mobile crisis service? Well, I know the case managers go out. And I know out in the States what has been not new, but frequently used as intensive outpatient programs. I'm not sure what our length of stay in Bermuda is acutely. Do you know? Anyone?
So we're lucky in the fact that people do have the ability to stay in inpatient care until they're well enough to return to the community and get the outpatient support from our community mental health nurses, from the psychology team, from whatever services they need to maintain wellness. So that's good.
One of the things that happened about 5 or 6 years ago, is that we moved from what was the traditional way of treating persons with mental illness, which was the medical model, where the plan and treatment plans and how you care for a person came from the staff, and they would say to the person with mental illness, this is what your plan is going to be, and you're going to follow this, and blah, blah, blah. But about 5 years ago, we moved into the recovery model of care, which is practiced a lot in the UK, and I think the US also uses it, where the client or service user has more of a say in how they are cared for. They are able to take risk with their care, and sometimes those risks may not be some of the risks that we want to see as the staff, but this is some of the decisions that they have made concerning medication, whether they want to take medication in the form of injections, or whether they want to take medication orally, or whether they want to take medication at all. They can make those decisions, but we then have to build our plan of care around those decisions that they have made. But the recovery model of care is supposed to give hope to the individuals and help them to see that there is life, even with a mental illness. There is life. And I have the fortunate pleasure of attending the Psychiatric Rehabilitation Conference in the United States on a couple of occasions. And when you go to those conferences, major conferences, and all of the people that present are persons who suffer with mental illness. And these people are not just anybody in the street, but these are people, there have been senators, there have been doctors, One lady presented, she was diagnosed with schizophrenia at the age 17. She is now a world-renowned psychologist who travels throughout the world giving talks about mental illness. So mental illness is not the end of the road. It certainly isn't the end of the road, just like a physical illness doesn't have to be the end of the road. The problem is in Bermuda, which I'm sure we'll get on to later, is that the only people that we see are the persons with mental illness, are the persons who has some obvious problems that present. But mental illness is in any section of the community. Doctors, lawyers, police, taxi drivers, bus drivers, anyone in our society can suffer with mental illness. So let's not put a face to it. It is any one of us.
I would just remind you in the audience that as you're listening and something doesn't sound quite right or you didn't quite understand what was said, formulate your question. There are cards available. Please write them down so we can make sure we address your concerns or issues. Thank you. Following on what Mr. Rogers has said, the next part of this discussion on management is, can a person with mental illness lead a relatively regular life? Can they deal with education? Can they go through training programs? Can they work? Can they engage in recreational activities? Can they successfully raise families? What's it like to live with a mental illness? What can an individual expect? And that's for the whole panel.
I've done all of those things. The answer obviously depends on the severity of the person's condition. I am fortunate enough to have had a very supportive family. As I got older, got into the correct treatment plan. And I have been successful at work. I have a husband and a daughter who exhibits currently no signs of any mental illness. And for me, I would have to say yes. There are certain things that, given my condition, I don't think I would be very good at. But I certainly would consider myself to be successful and fully functioning and a happy, normal person. But again, it does depend on the severity of someone's illness and how chronic it is, if it's what the episodes are like, what their treatment is like, what their support network is like. But I would have to say overall, yes, it is possible for someone with multiple mental illnesses to lead a relatively normal life. Not without some struggles and some ups and downs, but yes, absolutely.
That was a particularly difficult question, and probably one that we should have put a little more thought into the framing of the question, because it really does depend upon the condition that you're dealing with and the circumstances and the context. So I do want to emphasize that, but let's give one of the mental health providers an opportunity to address this.
Well, I was going to say something that you've actually just picked up in your comment. So the interest in traveling to the moon, I guess, is very much wrapped up with other industrial projects in the USA, and that led to NASA and computers, and here we are. Probably everyone in this room has a phone or some other gadget. But that's created some very interesting opportunities for people with autism. So if you go to California and you go to Silicon Valley, the incidence of people on the autistic spectrum is much higher than in most other parts of the world. These are people that are very high functioning on the autistic spectrum, and they are very good at coding and at computers, and that's why they get those jobs. So something that's happened in the world now has created a niche for people's disability to be actually something creative and a huge opportunity. In the UK, I've seen adverts on the front page of newspapers for auditors, and in the advert they'll say 7% of our staff have difficulties on the autistic spectrum. This is on the front page of a newspaper. This is an advert for auditors. I mean, who would have thought about that? And the reason is because people with autism, I'm talking generally now, very good with coding and numbers, and as auditors and bookkeepers, they will balance the books absolutely. So there's another opportunity for something that is very helpful for society that has now created a niche for people with this disability. I see also in the UK that I think the University of Bristol or Bath or both, their mathematics department decided that they would have a bigger intake of people with autistic spectrum difficulties. They are now producing better results in their exams than Oxford and Cambridge in that speciality. Those are just examples of how, the world is changing, and there's so many different ways to live in the world. And it brings joy to my heart that there are these opportunities for people.
I'm looking at the representatives from the Salvation Army and wondering if they have a take on this particular issue, since they provide services and support services in the community.
Well, what's interesting, as I was sitting here, I was thinking that the Salvation Army has a way of drawing those persons who are mentally ill into our environment. Case in point, frequently we have persons who come into our thrift shop who come making demands, some of them. Some come to get clothing. We had one gentleman, I'm going to share something that's perhaps a bit gross, but this shows the level of mental illness. He had actually soiled the clothes he had on, took them off, put them in a bag that had been left for us to sort through, and came in and took out comfortable clothes, and off he went. But when the sorters, of course, went in, there they found his the remains, and it didn't smell so good. But he came back to let us know that he had in fact done that. So we frequently get people who come for change of clothing. Some come to demand clothing. Interesting. Some come, we find some in our emergency housing, and sometimes their behavior there manifests itself in the form of violence. They will go from 1 to 10 very quickly. If someone is for example, talking on the phone and they're trying to sleep, they can become very agitated, and their response is not typical. It's not typical. But we do have a very good partnership with MWI. And when we have those persons within our environment who need, through the caseworker, it has been identified that they need to see a social worker or a caseworker at MWI, we do have that facility to assist us. In fact, there's a monthly case management meeting when members from MWI are working with us as we talk about common concerns that we have. I guess I see the magistrate. I can mention that at Harbor Light we had our very first gentleman who came through from the mental health court. Our very first individual who, one of our clients, he came with a social worker from MWI. He had a diagnosis of schizophrenia, and he was on medication, and within a month we saw amazing results. Initially, because he was our first, there was some concern, but he did extremely well communicated extremely well, and it was a joy to see him growing. But I think because the mental health court system is still, I could be wrong, I think it's still in its infancy, piloting. There are some things that need to happen with that, which might have helped us to be more successful with the gentleman that we had. He did really well for about 3-4 months. And then he had a mishap. He had, and what was interesting, and perhaps this speaks to our need, in terms of our need to be trained and assisted with working with individuals like that. The clients in the facility knew of how this gentleman had come to us. They were very supportive of him. You would not have been able to distinguish him from any others. Then we got a new client, and something happened between the new client and this individual. There was great irritation between them. I can't explain it. I just know that one night the gentleman from mental health court reached a boiling point, and he was unable to contain himself, and the gentleman who was on duty tried to calm him down, and it wasn't pretty. They were unable to, and we ended up, due to threatening behavior, having that gentleman leave our facility. As the executive director, when I came in and I found out what had happened, I was very, very, very distraught. Because, you know, to see an individual make such leaps, such movement toward wholeness, and then to see that happen. And so I began to think about what if we have another client from mental health court? How could we perhaps have better prepared the environment for success? How could we have assisted all parties concerned? I would just intimate here that seeing this lovely lady here, many of our staff have taken advantage of the mental health first aid course that is offered by MWI. It's amazing. And so we've tried with our thrift shop people and all people who interact with our public to be as prepared as possible so that we can de-escalate and not escalate when individuals come in. Because there is a tendency, when you see that individual, up goes your red flag, and sometimes they are, quote unquote, normal. They're good. But our behavior, we've learned, can trigger their behavior. So.
Thank you. I think that helps us appreciate from one panelist that the answer is yes. People can lead a normal, forgive me, can lead a productive life and a regular life, but that from the service provider, it does require some understanding and some knowledge to effectively deal with people with mental health conditions so as to be helpful to them. Mr. Hansen, did you have a comment? I took the mic from you very abruptly.
Thank you. Hearing the story of the individuals at Bath Uni and Bristol University, very positive story. One of the main concerns from a social side, we've talked a lot about the health side so far tonight. One of the concerns from the social side is equal treatment of someone with mental health, and that's a classic example of people who are actually encouraged to apply for roles, be it audits or through universities. And I'm not sure many people here will be aware of this, but within our Human Rights Act 1981, disability is only described or prescribed to physical disability. We have no protection in this country. It's on a social level, in an employment level, for those who suffer from mental illness. And quite frankly, that's as disgusting now as it was 25 years ago. You know, in fact, I can be quite dramatic here. I'm not aware of any other country in the world who follows a common law system, which is effectively our legal system, who doesn't have protection in their equivalent act, be it the Equality Act or Disability Act, for people with mental health issues. And we can see what that kind of protection can do. I am amazed that we haven't got it here yet. And it's something, obviously, from the HRC perspective, that's what we're pushing for, because we need the law to be able to enforce it.
I believe there's a comment from the back.
Good evening. My name is Eleni Belivanaki, and I'm a consultant forensic psychologist. I work in corrections. I've worked in the UK in mental health for the last 20 years, and I've only been in Bermuda for 6 months. And my question or point is relevant to accessibility to treatment. My biggest struggle since I've been here is that we don't have a forensic unit in Bermuda, and we have a lot of inmates who suffer from mental illness. Now, I just wanted to see what your views were in relation to their accessibility to treatment, a proposal to government to start up a forensic unit, and also, you know, human rights and where that comes into it, and what we actually can do for those inmates.
Well, certainly from a human rights perspective, and I can be brief, as I said, from a commission's point of view or a tribunal, we have absolutely no statutory authority to do anything. We just don't have the power. If someone makes a complaint to the commission that they have been discriminated against on the grounds of their mental health or mental illness or harassed, there is no remit for them under our law. That is just a fact. It's a terrible fact, but it is one. On the health side, and I'll pass it across, I'm sure there are, but from a social perspective, if someone complains of discrimination, and we have a lot of those complaints, of discrimination on the grounds of their mental health, we cannot help them. That we can point them to a health side of things, but we cannot help them on a social side.
Are there any other comments before we move on to our next area of discussion? No. Next, we'll attempt to look at what resources, services are actually available on this island for people who suffer from mental health conditions and who may need some assistance or treatment or management. Hopefully we'll focus on what services are available, how are they organized, and some attempt to look at how effective they are.